If your cat looks like they're starring in a Stephen King horror movie with those creepy white membranes partially covering their eyes, don't panic, but don't ignore it. Those are your cat's third eyelids, and they might be trying to tell you something. In this video, we'll chat all about your cat's third eyelids, what they are, what they do, and what it could mean if you suddenly see them. Hi everyone, I'm Dr. Oz. Cats have a third eyelid tucked in the corner of their eyes, near the nose. It is typically white to light pink and has a smooth texture. Why do cats have a third eyelid? They have a few jobs. They help protect the eye, like when your cat flinches. They help keep the eyes moist, and they help clear away debris in the eye like a built-in windshield wiper. When is it normal to see my cat's third eyelid? You may briefly notice your cat's third eyelids if they're sleepy, super relaxed, or just waking up from a nap. You may also notice your cat's third eyelids if they're recovering from sedation or anesthesia. In all of these scenarios, the eyelids are up for a short amount of time before returning to their hidden location, and usually nothing to worry about. If you notice your cat's third eyelids are up for an extended amount of time, that may indicate something is wrong. Do you see one or both eyelids up? The first clue something is wrong is that you only notice one of the third eyelids is up. In all likelihood, there is usually an issue on that side of the body. That could be something that directly affects the eye, like an ulcer, foreign object, infection, or inflammation. You should also notice other symptoms associated with that eye, like redness, squinting, discharge, or blinking. It could be something affecting the nerves on that side of the body, like Horner syndrome, which is a set of symptoms that includes a raised third eyelid. It could be triggered by an inner ear infection, trauma, or issues in the chest and neck because the nerves travel a long way from the brain to that eye. In many cases, though, we never find an exact cause, and I most commonly see an inner ear infection or trauma to that side of the face. You might have heard of cherry eye, especially if you own a dog, and it's very noticeable. It looks like a red bulging mass in the corner of the eye. It occurs when the gland in the third eyelid pops out. I see both eyelids up. If both third eyelids are visible for a prolonged period of time, that usually means something is affecting your cat's entire body. Dehydration and significant weight loss can do it. Rarely, Horner syndrome can occur on both sides. Hall syndrome is a condition where both third eyelids are elevated for a reason not involving the eyes, and oftentimes associated with a gastrointestinal issue like vomiting, diarrhea, or parasites. I often hear pet parents say their cat had watery diarrhea a few days before the eyelids popped up. What should you do? If your cat just woke up or is recovering from anesthesia, give it a little time. But if those third eyelids continue to be visible, it's time to call your vet. Your vet may stain an eye looking for an ulcer, use phenylephrine eye drops to help diagnose Hall syndromes, or begin a treatment to help correct dehydration, address a digestive symptom, or clear an infection. More serious underlying issues like a polyp or an inner ear infection may require a more targeted approach, and healing can take some time. Cherry eye usually requires a surgery to fix it. If trauma caused permanent damage to the nerves, complete resolution might not be possible. Sometimes we don't find a clear cause, especially with Hall's and Horner syndromes. In these cases, supportive care and time can do the trick, especially when diagnostic tests are negative or normal. So if your cat's eyes look spooky, don't ignore them. That third eyelid may be the first clue something deeper is going on. If you learned something or enjoyed this video, like, subscribe, and comment. Thanks so much for watching, and I'll see you on my next video.